Hey everyone, it's Dr. Pathania, and I'm an ENT surgeon. Have you ever woken up feeling like you didn't even sleep, like you're more tired than when you went to bed? Well, you might be one of the millions suffering from obstructive sleep apnea, or OSA. OSA is serious. It's more than just loud snoring. It means your breathing actually stops and starts during the night because your airway gets blocked. That blockage can be caused by a number of things, and it disrupts your sleep and robs you of energy. But importantly, it can have impacts on your health that go far beyond just feeling tired. Now, a lot of people try lifestyle changes and things like CPAP machines, and those can be really effective for some, but for others they need a more permanent solution, and that's where surgery comes in. In this video, we're going to break down the different types of surgeries that can help treat OSA and get you sleeping soundly through the night. If you're struggling with OSA and haven't found relief, this video is for you. Stick around because we're going to cover everything you need to know. The first procedure we're going to talk about is called uvulopalatopharyngoplasty, or UPPP. It's a bit of a mouthful, I know. Essentially, UPPP is all about creating more space in the back of your throat. You know, that dangly thing in the back of your throat, that's your uvula, and it can actually contribute to snoring and OSA. In UPPP, we remove excess tissue from the back of the throat, including the uvula and parts of the soft palate. This widens the airway and reduces the vibration that causes snoring and apnea. Now, you might be wondering, what's the recovery like? It varies from person to person, but generally you can expect some pain and swelling for a couple of weeks. You'll be on a soft food diet for a while, and it's super important to avoid smoking and alcohol during the healing process. The good news is UPPP can be really effective for the right candidates. It can significantly reduce or even eliminate snoring and apnea, leading to better sleep and improved quality of life. It's a great option for people with moderate OSA who haven't had success with other treatments. Let's move on to the nose. You might not think your nose plays a big role in sleep apnea, but it actually does. A deviated septum, which is when the wall that divides your nostrils is crooked, can obstruct airflow and contribute to OSA. And then there are the turbinates, which are small structures inside the nose that help to humidify and filter the air you breathe. When they become enlarged, they can block the nasal airway. That's where septoplasty and turbinate reduction come in. Septoplasty straightens the nasal septum, while turbinate reduction reduces the size of the turbinates. Both procedures aim to improve airflow through the nose, making it easier to breathe, especially during sleep. Recovery from these procedures is usually pretty straightforward. You might have some congestion and need to wear a splint for a while, but most people recover quickly and experience significant improvement in their breathing. This next one is especially relevant for children and young adults. You see, enlarged tonsils and adenoids, which are tissues located at the back of the throat and behind the nose respectively, can obstruct the airway, leading to OSA. Now, removing tonsils and adenoids might seem like a big deal, but it's actually a very common procedure, especially in kids. It can make a world of difference for those who are struggling with OSA caused by enlarged tonsils or adenoids. Recovery from tonsillectomy and adenoidectomy can be a bit more challenging than some of the other procedures, especially for adults. There's going to be pain, swelling, and you'll need to stick to soft foods for a while. It's really important to stay hydrated and get plenty of rest, but remember, the long-term benefits outweigh the temporary discomfort. Imagine your child or yourself finally getting a good night's sleep, waking up refreshed and full of energy. That's the goal, and it's achievable. Now let's talk about the tongue. Believe it or not, sometimes our tongues can be the culprit behind OSA. You see, for some people, the base of their tongue relaxes too much during sleep and falls back, blocking the airway. That's where tongue base reduction comes in. It's a procedure designed to reduce the size of the tongue base or reposition it to prevent it from obstructing the airway. There are different techniques for tongue base reduction, and the specific approach depends on the individual patient. It's typically combined with another procedure like UPPP to address multiple levels of obstruction. Recovery from tongue base reduction can vary depending on the technique used, but in general, you can expect some pain and swelling, and you'll need to be on a modified diet for a while. Similar to tongue-base reduction, genioglossus advancement, or GA, also focuses on the tongue, but instead of reducing the size of the tongue base, Georgia repositions the tongue muscle attachment point. It's like pulling the tongue forward to prevent it from collapsing back and obstructing the airway. During GA, a small piece of bone from the lower jaw, where the tongue muscle attaches, is moved forward and secured with screws. This moves the tongue attachment point forward, preventing it from blocking the airway. It's a minimally invasive procedure with a relatively quick recovery time. Most people can go back to their normal activities within a week or two. GA is a great option for people who have a recessed lower jaw or whose tongues are prone to falling back during sleep. Now, what if your OSA is caused by a combination of factors? What if you have a deviated septum, enlarged tonsils, and your tongue tends to fall back? Well, in those cases, we often recommend what's called multi-level surgery. This is where we combine 2 or more procedures to address obstructions at multiple levels of the airway. For example, we might perform a UPPP to widen the back of the throat, along with a septoplasty to straighten the nasal septum, and a tongue-base reduction to prevent the tongue from obstructing the airway. This comprehensive approach can be highly effective in treating complex cases of OSA. Of course, multi-level surgery is more involved than a single procedure, but with a skilled and experienced surgeon, it can be life-changing for people with severe OSA who haven't found relief with other treatments. So there you have it. We've covered a lot of ground today talking about different surgical solutions for OSA. Remember, OSA is not something to ignore. If left untreated, it can lead to serious health problems like heart disease, high blood pressure, stroke, and it can even make you dangerously sleepy during the day. But the good news is there are solutions. With the right diagnosis and treatment plan, you can overcome OSA and start living a healthier, more fulfilling life. If you're in the Gurgaon area and you're struggling with OSA, I encourage you to reach out to us. We're here to answer your questions, address your concerns, and help you find the best treatment option for your individual needs. Don't let OSA hold you back any longer. Take control of your sleep, take control of your health, and start living your life to the fullest. Thanks for watching.